when you understand the reason of bleeding in dengue, then you know transfusing FFP or cryo is not really indicated. Okay, so why does bleeding occur in dengue? First, bleeding in dengue occurs due to the combination of vascular leakage, and then we have platelet dysfunction. There is also some coagulation abnormalities and disseminated intravascular coagulation light changes. See, the IC light changes rather than the true DIVC. First, we talk about what caused the bleeding. The first cause is basically the increase in capillary fragility and also leading to vascular leakage. Okay, so why it happened? Because dengue virus itself damages the endothelial cells and also lead to increase in capillary permeability. So this plasma leakage can lead to hypovolemia and shock. Also, when shock happen, it lead to reducing perfusion to the vital organs. Okay, also these damages also can cause fragile capillaries to rupture easily, so can lead to petechiae, purpura, and even mucosal bleed, depend on the degree of the bleeding. Alright, so the second cause of the bleeding, it can happen due to thrombocytopenia itself, due to low platelet count. Okay, so why there is thrombocytopenia? Because there is platelet destruction due to immune mediated mechanism and due to bone marrow suppression by the viremia from the dengue virus itself. Okay, so usually when does bleeding happen due to thrombocytopenia is when the platelet count fall below less than 50,000 per millimeter. Alright, so if less than that, there is increased risk of spontaneous bleeding. Okay, so because of the sometimes shock itself also can lead to dysfunctional platelet, so can further impair the clot formation itself. Okay, so the third reason is because of coagulation abnormalities. This can happen due to first liver dysfunction in dengue, because it affect when there is liver dysfunction, it can affect the clotting factor production, so can lead to prolonged PT and hepatitis. Alright, in severe cases, especially when there is shock or prolonged shock, there is consumption of clotting factors that can mimic like the IVC. Okay, so and there is shock also when there is metabolic acidosis, it can lead to the conversion of your fibrinogen to fibrin, so can lead to impact clot formation, can lead to bleeding. Alright, so the most important cause of bleeding in dengue is hypotension due to prolonged shock, can lead to tissue hypoxia, because in severe dengue there is severe plasma leakage, can lead to hypovolemic shock, so can lead to tissue hypoxia. So when hypoxic tissue, there will be lactic acidosis, will be lactic metabolic acidosis, so this can cause endothelial damage itself, so it can impact hemostasis, can lead to bleeding, and can be exaggerated due to other factors such as your thrombocytopenia and then capillary permeability and endothelial damage as well. Okay, so that's basically at least 4 reasons why dengue can happen. So in the less severe dengue, in the normal dengue, usual dengue fever, the bleeding can be due to the thrombocytopenia itself, can be due to viremia itself, due to capillary fragility, and then can be due to thrombocytopenia. Okay, so when there is shock happen, so this can lead to even more bleeding, even more occult bleeding. So the metabolic acidosis can lead to the much more severe bleeding. So that's why when you understand the reason of bleeding in dengue, then you know transfusing FFP or cryo is not really indicated, it's not the preferred blood product, because that one is more for the typical IVC cause of bleeding. Okay, where you transfuse the IVC regime include your platelet, cryoprecipitate, and your FFP. Okay. Alright, so if you read our CPG guideline for dengue fever in adult or even in children, for blood transfusion, the preferred blood product is first is your packed red blood cell, and second, if you don't have packed red blood cell, you transfuse fresh whole blood. Okay, so why is it so? Okay, so the main thing, if you transfuse cryo or FFP, that one is part of your plasma. As you know, in dengue there is plasma leakage, it will just leak out. Okay, and then so PEG RBCs are preferred is due to it can improve your oxygen deliveries, because PEG RBC contain high concentration of your RBC, which the most important thing to carry your oxygen, and then improve the tissue hypoxia that happen during dengue shock. Okay, and then because of bleeding, there is severe anemia, so the PEG RBC is needed to restore the hemoglobin level, so to restore the oxygen carrying capacity to the tissue. It also can help the volume overload, because PEG RBC also don't have excessive plasma or platelet. So as you know, in dengue also there is plasma leakage, so this one also prevent necessary plasma leak due to the dengue itself. Okay, so in CBG also mentioned fresh whole blood. Why fresh whole blood? Because in fresh whole blood, the functional numbers of platelet is still a lot compared to the stored whole blood, the whole blood that has been more than 1 week, and then this whole blood they lost the normal platelet function lah. Okay, and then on top of it, your fresh whole blood also contain clotting factors like your fibrinogen, your factor 8, which is essential to prevent the bleeding lah. So in whole blood, the numbers of this clotting factor may have been reduced or depleted. Alright, okay, and then yeah, of course, I think that's basically the concept, the reason why PEG RBC and fresh whole blood is preferred compared to your FFP and cryo lah, like your DIBC regime.